Hi, I'm Chris Bailey, and I'm a general surgeon. I know surgery is one of those things that you hope you never need, but chances are if you're here, you weren't so lucky. Today, I'd like to reduce some of the anxiety associated with surgery by giving you as much information about the process as possible. We're going to discuss the typical ins and outs of a general surgery operation, to include the preoperative preparation, the night before surgery, the day of surgery, and the period after surgery before your first follow-up appointment. Now, although many of these concepts are very similar, they may not completely agree with operations of other specialties, so please keep this in mind going forward. Depending on your age and general state of health, a certain number of tests may be required prior to you having surgery. The overall goal here is to assess your level of fitness for an operation, and in coordination with anesthesiology, we will attempt to mitigate any risks that you may have prior to your operation. We will also determine which medications you will need to continue and those you should stop taking in the days leading up to your operation. Generally speaking, any medication that is used to thin or reduce the clotting capacity of your blood will need to be held, and you should ask specific questions regarding them and your care. Typically, patients with an irregular heartbeat, mechanical valves, stents, or grafts in their blood vessels, a history of blood clots, or a known clotting disorder are the only ones on these medications. However, if you are not sure, just ask. All diabetes-related medication is usually held, and insulin injections are often cut in half. A specific plan will be formulated on an individual basis, just for you. Blood pressure and heart medications vary as well and should be tailored. Steroids, thyroid medications, antidepressants, cancer, HIV, antibiotics, and other less common medications should be treated on a case-by-case basis. Any other medication, herbal, over-the-counter, or prescribed, not mentioned here, should be discussed just to be on the safe side. One of the things that I would really like you to take seriously prior to your operation is smoking cessation. If this applies to you, smoking can affect your operation in a number of ways, and none of them are good. It is recommended that you quit smoking at least 8 weeks prior to surgery. Having surgery during this period actually puts you at higher risk secondary to an increase in airway secretions experienced during the first 6 weeks after stopping. Sometimes we don't have the luxury to wait that long and are forced to accept the risks associated with this habit. If interested in quitting, please discuss your options with your primary care provider and surgeon. Now, let's talk about the day before surgery. It's a good idea to pack an overnight bag with some basic toiletries, socks, underwear, and loose clothing. In the event that your operation doesn't go as expected, you may be required to stay in the hospital for an overnight observation. If you packed a bag, this hospital stay will be much more comfortable. In addition, you'll want to bring all of your home medications with you. Some of them may not be available. If you know you're going to be admitted, this becomes all the more important. If you have sleep apnea and use a CPAP machine at home, it's recommended that you bring it with you to surgery. Lastly, be sure to confirm your transportation arrangements. You will not be able to drive yourself home. The night before surgery, it is recommended that you have a typical dinner and not treat it like it's your last meal. A light snack before midnight is a good idea to help curb any hunger pangs in the morning, but really nothing should be taken by mouth after midnight. Once checked into the surgery center, you will change into a gown and someone will place an IV for medications during the procedure. You will be placed in a staging area where you will be introduced to your anesthesia provider and be given the opportunity to discuss any residual questions that may have come up. Once you're ready, we will confirm the site and type of surgery, make sure we have made arrangements for any special needs that you may have for the procedure, and proceed to the operating room. By this time, you will be given something to relax, and you may or may not have amnesia from this point forward. You will be moved over to an operating table, full anesthesia will commence, and we will perform your surgery. After surgery, your first conscious experience will usually be in the recovery room. There, nurses will be available to monitor your condition, manage your pain, and let you know how things went. Once you're stable enough for discharge, you'll be given instructions and a follow-up appointment depending on the type of surgery you had, usually within 1 to 2 weeks. Generally, the first 3 to 5 days after surgery are the most difficult. Some bounce back right away, and for others it's a little tougher. Everyone handles the stress differently. In all cases, it's a good idea to get around the house, take care of some basic things, and get some rest while the anesthesia wears off. It's completely fine to go outside and use the stairs. Most patients experience some degree of nausea for the first 24 hours after anesthesia. Eat lightly, and if you are unaffected, consider yourself fortunate and move on. Some people, after having laparoscopic surgery, may experience pain in their shoulders. This is due to the carbon dioxide gas, which is used to open the inside of the abdomen during surgery. This should resolve on its own in 24 to 48 hours as the excess gas is absorbed. Use a small pillow, hug it against your abdomen to help brace your incisions if you need to cough or sneeze or do deep breathing exercises. Roll to one side and use your arms to push yourself up when getting in or out of bed or a chair in order to not use your abdominal muscles. The restrictions after surgery are pretty self-limiting. There is no lifting more than 20 pounds and no aerobic exercise, other than walking, until your follow-up visit, which is usually about 2 weeks after surgery. Further restrictions will be discussed at that time. You may return to work or school as you feel you are ready, with lifting restrictions in mind if you have a labor-intensive job. There is no driving for 24 hours after surgery and while taking narcotics. You may drive when you feel that you can safely operate the vehicle. Pain control will be managed with an anti-inflammatory, acetaminophen, ibuprofen, or naproxen, with or without a narcotic. Narcotics are recommended when the pain is not controlled with anti-inflammatory medications and the pain is intolerable. Narcotics are relatively ineffective at getting rid of pain and really only make you care less about it. They also make you constipated. If you have not had a bowel movement within 3 days of surgery, pick up some Miralax. Take a scoop with 8 ounces of water or juice daily and continue this management until you are successful. If you are someone who tends to be constipated anyway, you might want to consider taking the Miralax prophylactically starting right after surgery. If this regimen is still ineffective, call your surgeon for a more aggressive recommendation. After surgery, you will have 1 or more incisions. These will be covered with steri-strips that look like small pieces of packing tape and a gauze bandage. Wait 24 hours to take a shower and remove the bandages at that time. The steri-strips will come off on their own, usually in 5 to 7 days. It's okay to get them wet in the shower, but do not submerge them under water for 1 week. Once they start to peel up, just finish pulling them off as long as they come off readily. If they are stubborn, just trim the excess and the remainder will come off in due time. If you have skin glue over the incisions, this will wear off in about 1 week. Do not try to scrub it off. Some bruising and soreness is expected around the incisions. Remember, we had to cut through the muscles. Afterwards, do not place any lotions, oils, or scar creams over the incisions for 6 weeks, as they may actually worsen the scar and increase the likelihood of the incision opening back up. Also, avoid sun exposure for 6 months, as UV light can permanently darken the scar. Ultimately, there is no such thing as a little operation. We do this every day, but we understand that you don't. Our goal is to make what can be a very nerve-wracking situation into a very smooth and organized process. We certainly appreciate you trusting us with your care.